All right. Well, let's go ahead and get started. Good evening, everybody. My name is Albert Wong. I'm the PTA Council representative for the APTA Orthopedic section. It's good to have everybody on the call this evening. Hopefully, this town hall is going to be one of many
Sorry,
town
my
halls
headphones are in charge.
that we have in the future. And basically, what we want to do or what we want to try to accomplish this evening is really just hearing from you and hearing from you that as the members, the PTA members and students on what you all like to see to be in the future to be engaging or want to engage in APTA orthopedics. So my role as a PTA representative is really to represent the voice of you as the PTA for APTA orthopedics. I think what a good thing to start with this evening is just a little bit of just some updates from the PTA world and what's happening there. So as the representative, I attend quarterly PTA council meetings and we talk about different things that are and different opportunities that may be happening for PTAs as a whole. And a couple of things at the last quarterly meeting was talking about the PTA Foundation for those and the PT Foundation. For those of you who are not familiar with the PT Foundation, Marquette University has this foundation for research, and basically they raise money for PT research in you know for just for PT research in general. And basically every school has the opportunity to participate in the Marquette Challenge. And for more information on that, you can definitely reach out to me or look up on the information on the APTA website about the Marquette Challenge. So that was one of the items that was brought up at the last quarterly meeting about PTAs and how they can get involved in and learning more about that. The other thing we discussed was PT Moves Me. For those of you who are not aware about PT Moves Me, it's an awesome opportunity for PTs and PTAs to really talk about the PT profession and really serve as an ambassador, whether it's in their clinic or in their community, and look at some things that are available for PTAs to kind of just educate people about PT, because some of us may not really know what we do, or may think that they kind of have an idea of what we do, but maybe wasn't aware of some of the different exciting things that we get to do for PTAs and PTs and serving our patients every day. So that's a little bit about what we talked about the last quarterly meeting. And really at this point, I kind of want to and one other thing I've also forgot to talk about was on the PTA APTA orthopedic section, we do have a community page. It's a APTA Ortho has these community pages, and PTA has one. So as a PTA member, that's one of the opportunities you get to do or get to participate in is really the community page. And the benefit of being a member is you get the opportunity to engage and learn about some different things. And hopefully in the future, we'll put some more content on there. So that way you as PTAs can be engaged. So really this evening is all about you as PTAs, and really want to hear about what it is that you would like to see in the future as a APTA orthopedic member. So what we'll do is kind of open up the floor to those on the call. And if you want to participate, I would go ahead and just have the use the hand raise button, or you can just start talking, and then we'll recognize you, and then we'll kind of open up the floor from there. So that being said, we'll go ahead and open up the floor and want to hear from you.
Hi there, Albert.
Hi. Hi, Jess. Is
Uh,
that Jess?
it is. Sorry,
Hi,
I was
Jess.
just I was just at the gym, so I'm not really camera ready. But
That's okay. Thank you for being here.
yeah, absolutely. I love, I saw your post on the PTA Council community page that this was an open forum. So I was an orthopedic member for a long time, until I became an educator, and then I switched to the Academy of Education. And unfortunately, um, no, let me rephrase that. Fortunately, my employer does reimburse me for my APTA dues, but only allows me to be a member of one academy at a time. So I don't really have all the perks of being an orthopedic member anymore. And I guess my question is just going to be more like, are there going to be other non-member opportunities within the orthopedic section? Because I love to participate and I love to learn about ortho. Just unfortunately, I can't be a member right now.
Sure, that's an excellent question. I do not have all the answers for that as far as opportunities for a non-member. There are some general information that you can certainly go on the website when you go on the APTA Orthopedic section. You can maybe look at the website and just see, as a non-member, see what things are being offered for from APTA Ortho. But for a non-member, I will have to get back to you on that. I don't have all the answers on that. There may
Yeah,
be
that's fine. And again,
other folks, yeah. There may be
I can
others
say
on
I
this
can.
call that may be able to address that, but as a non-member, I do not know the answer, but we'll have to get back to you, or at least maybe somebody on the call can address that I don't have the answer for.
Sure.
But yeah, just looking for any, really the APTA engagement page is just an opportunity to go ahead and engage as a APTA ortho member. And hopefully this year, hopefully in the future, we'll put more content. But really, that's what the town hall is for this evening, is just kind of hearing from you all and just seeing what it is, that you would want as a APTA orthopedic section member, to, what is it that you want, that you would feel value from as a member, so you can try to engage. We want PTA engagement. We want to let PTAs know that their membership is valuable, and we really want the PTAs to be engaging in orthopedics in our section. So this is a good opportunity to do that, and that's the reason why we form these community pages.
Albert,
Anybody? Yeah.
oh,
Hello.
Alberta, this is Tara Frederickson, staff at APTA Orthopedic. One thing that I would mention to the group that Albert and I were talking about before the webinar started this evening is, in the future, we're hoping that Albert will help lead an initiative of maybe some additional webinars, some interviews, and create some content that we would be able to put out on the APTA Orthopedics YouTube channel. Jess, if you haven't visited our YouTube channel, it's definitely growing nicely. And so I would love to see our PTA community become more engaged with putting together some of those webinars, the interviews and presentations. So, and that right now, a lot of those presentations, those videos are open access on our YouTube channel. So that would be something that we hope to see coming in the future.
Right.
And Jess, I think I'm gonna pipe in a little bit, Albert. I'm Derek Swicky. I'm the board liaison for your group, and as the APTA board, one of the things, or APTA Ortho board, one of the things that we really are looking to try and do over the next couple years is to increase member engagement. And we realize that sometimes to increase member engagement and member retention, we need to be able to talk to people who aren't members, and you have opportunities for people who aren't members. So if that's something that you're really interested in, Albert, and you decide that that's what your community is interested in, then I can take that before the board and I can say, hey, what are our opportunities to provide, events or provide offerings that may be open to people who aren't members as well. And so if that's something that you're interested in, you can email me, Albert, and we can start a dialogue on that, and I can bring it before the board for you.
Great. Thanks, Derek. That sounds wonderful. I think that's anytime, because at the end of the day, what we want to do is engage and increase engagement. And I think that would be an excellent opportunity, especially for folks who may not be members, may be thinking about being a member, and give them an opportunity to engage in APTA Orthopedics. So that would be a great opportunity. Thank you for that information.
Yeah, and actually, well, I like that idea too. And Albert, I wonder, so I was a chapter PTA council rep for a long time, and that's always been our issue too, is engagement with PTAs. And I wonder if there's maybe some sort of initiative where we can think about academies and chapters instead of recreating the wheel 70 times or whatever it is of events where we can allow non-members to come see what we're all about, engage. 'Cause I wonder if that's a platform that could be used in like the orthopedic section as well as the state of California, you know, for anybody to kind of like host these non-member events to engage people and maybe increase membership.
Yeah, that's absolutely a good opportunity to do that, especially for folks who may not be aware of whether it's APTA Ortho or another section or academy. You know, maybe they're not sure what membership entails. So having opportunities for non-members can be very beneficial for that. So that's great.
And I would kind of chime in here that from a student's perspective, that um, it would be nice to have some sort of a student ambassador, right? That can maybe reach out to the PTA schools, maybe work with the student special interest groups of the different states to really get the voice out there. Because you know, I started PT stuff a long time ago, and I'm coming back to it now. And when I was introduced into APTA right away, it was just like, join APTA. Okay, that's great. APTA is a huge organization. Like, and then you start breaking it down into these subsections. Well, no, if you don't know that those exist, or you're still just going through your schooling, you know, you're not exactly sure where you want to fit. So maybe that's something where you have a student ambassador that's reaching out to the schools to kind of get that info out there that, hey, we have an orthopedic section. This is what it kind of entails. This is, I don't know what that would look like, but really kind of getting info out to the different PTA schools that the whole makeup of APTA is more than just a single organization, because I'm not so sure that that's being, and I'm just speaking from personal experience, being handed down through the education platform that way, if that makes sense.
Yeah, absolutely. I think you're correct. I mean, when I know when I was a student, you know, we heard about APTA, but you're absolutely right, Josh. You're spot on. I mean, I wasn't even really aware of APTA orthopedics or neurology or whatever the different sections and academies are. You know, as a student, I kind of thought, yeah, you know, to your point, APTA is an organization, and I didn't know where to go. I'm like, hey, yeah, you should join APTA, just like doctors have an AMA, and you join the AMA, but you don't really know what that means as a student. Because as a student, I'll be honest, I'm just trying to get through my classes and take the board exam, and more importantly, pass the board exam. APTA, while I was active as a student, wasn't really at the top of my priority list. So yeah, you definitely make a good point. And I think the point of entry is as a student, because that's where you're I mean, hopefully we're all very excited about what we do as clinicians and as professionals, but I think at the beginning you're most excited because that's something new and exciting to you, and that's where we really want to attract new members, is at that student level, because I think that's really the feature of our profession, is when that student comes into that profession, and just making sure that they're aware of different opportunities and avenues. So I think this conversation this evening is one of many good conversations that will help grow and show others what APTA Ortho has to offer, whether it's through a community page or whether hopefully you know, offering some non-offering or non-member offerings, I should say. And that way they can kind of see, hey, this is important. This is why I want to be an orthopedic member. This is valuable to me, because it has to mean something to them in order to want to engage and participate. So yeah, thank you for the insight and input. I appreciate that. Love to hear from anybody else that's on the call
Albert,
this
can I
evening. Yeah.
Albert, can I share something a little bit about these engagement communities and what our vision is for these engagement communities? You know, we realize that in today's society that people sometimes lack a ability to hang out with people who have the similar likes and dislikes and have similar views of what they're looking at in the profession and in the world itself. And so because people are so isolated sometimes, they feel like they want a community, a place to join where they can talk about things that are relevant to them, things that all of you guys are going through at the same time, not only for support, but also to look for opportunities to maybe make change as well. And so what we're doing is providing these different communities around topic areas to allow you guys, the physical therapy assistants, an opportunity to talk about things that you have in common and things that you're struggling and things that are working for you, so you can help each other grow and get better in your profession and the things that you do. And so we're hoping that this is the beginning of an opportunity for you guys to get together and, go to a place to hang out where everybody knows your name, right? And so a place where you guys can feel comfortable and share a safe space where you guys can open up and say, hey, these are my struggles. These are the things that are working for me. And then I'm here to say, well, what are you going to do to make a difference, right? And how are you going to change that? And let's see if I can help you with that process as well, to see if we can move things forward and make life a little easier for you guys, or a little better. So we're hoping that these communities are an opportunity for you guys to talk it up and see, these are the things I'm struggling with. And when I'm here, use it as an opportunity. Say, hey, Derek, these are things we need help with, and how can you help me? And so right now, I'm new to your group. And so as you guys are talking, I'm taking notes and saying, okay, these are things that that it sounds like they want some help with, like things like non-members. How can we get non-members engaged in these type of things? And so if you have other thoughts, let me know, speak out, because this is your opportunity to make a change and hang out with people that have the same things, same struggles you do. So just want to add that in, Albert.
Yeah, that's great, Derek. And I was at a conference one point, and one of the PTAs had mentioned about finding your tribe, and I think that's kind of spot on. About these communities are really finding that tribe, especially if you're a new professional, or maybe you're a seasoned professional and you are having some struggles. And I was talking to Tara earlier, before this evening's meeting started, that what I was hoping to see in the future is, as you know, an APTA ortho is, as a clinician, maybe seeing some clinical pearls on the community site. Maybe, to your point, Derek, maybe as a new student, new clinician, there are some things that, if you do manual therapy as an example, or if you're treating a condition and you're like, hey, you know what, I know a little bit about this, or I remember this from school, but this is a little bit different. Maybe using that as an opportunity to network and communicate, and then get better as a clinician, and then and also have an opportunity to network at the same time, and finding people that you may not knew that you had a common interest. Jason Oliver, who's on the call this evening, I didn't realize that. I forget what I think his school, I think it's LSU, if I'm not mistaken. Jason, you can correct me if I'm wrong, but I didn't know he was an LSU fan. I think you are. If you're not, I apologize. But that was one of the things I didn't realize. So that's little things like that kind of bring us together. And I think that's really helpful, whether it's this community or any other community. So thank you for those valuable words, Derek.
Hey Albert,
Hi,
it's good
Danny.
to
How are
see you
you?
again. It's been a while.
It has been a while. Great to
Yeah,
see you. Thanks for joining us this evening.
yeah, sorry I jumped on late. My kids were coming home from gymnastics class. So,
Oh, yeah.
but hi everyone. My name's Danny Buckmueller. Al and I actually used to serve together on the PTA council. Used to be the rep for Georgia, and then I relocated to Kansas last summer. So slid out of that role, but still very near and dear to my heart. And I'm hoping that maybe I'm not like rehashing or repeating anything that somebody else may have said that I may have missed prior, but just thinking from the standpoint of engagement, both at the PTA student level and also for practicing clinicians, you know, either whether that's new clinician or ones that have been out and practicing. I think we all kind of know that there has definitely been a challenge as far as just general engagement and membership, and also seeing like the benefit and value of APTA membership as a whole, right? But I will say, like, from my experience with some of the things that that we worked on from the student standpoint, one was obviously getting in front of actual students, like going to the different PTA programs, talking to them, telling them about our personal experiences in the organization and how we saw the personal benefit of it. And also kind of getting that connection as far as like getting more, I guess, more direction to the sections and academies, finding out what the students that were in the programs were kind of getting ready to, or what they were kind of veering towards as far as interests. So, you know, if I knew somebody really was like, I really think I want to do acute care, like, okay, do I know anybody within my leadership team that is like, you know, in that space, and who this would be a really, really great person to connect them with, just to kind of create that pipeline from there, just to say, okay, well, if it's already being encouraged as a student to be a member of APTA, which it was in my program, it was required. But having that personal connection kind of really helped solidify that person's direction to be like, okay, I know I have an in, I have a connection there. I know this is another area that I can go to get more knowledge and to find kind of that community of other like-minded people who are passionate about the same area of PT. So that was one way that we got some students kind of connected in that way. But also we had like it was a Facebook page that initially started out just for members of APTA. But then I knew on the outside, I also had so many friends of mine that I had gone through my program with who were just kind of like, oh, we're not really feeling it. So we expanded that and offered and invited some non-members to join, just so we could also get some feedback from them about what things they felt were kind of barriers for them to membership, to kind of hear about some other things, or about attending some of the events that our state chapter was holding, like locally. Like, what are some of the issues that you're having? And so even though they weren't officially a part of the APTA membership, it was a good way for us to get some feedback as a leadership team and kind of say, okay, you know, what's one of the issues? Well, there's not enough this location is too far away from me. Okay, well then does that mean we need to maybe break things out into smaller areas and have more focus groups geographically based on where people are? Is that going to help meet the need to entice you to want to come to be a part of it? Like, even if it's not getting to get full membership, at least like, will you show up to this event if we do this? Or people saying, oh, like, we don't have a way to pay for it. Okay, well, could we potentially sponsor or cover 2 free registrations, or give away 2 free registrations to encourage you to come to a state conference to see what it is that we do? So those were things that we were trying to think a little bit outside of the box and still reach those non-members as well, and kind of helping the ones that were members to also see, like, look, we're really, really trying on our side to reach, you know, the people who matter to us, the people that make up our profession. We want to hear your voice. In addition to that, there was one other thing that I was thinking of. Oh goodness, I lost the train of thought, but maybe it'll come back to me at some point. But oh yes, so as the member, being the person in whatever your individual setting is, to also carry on the information. So when APTA sends out, you know, something saying, yes, look at this big thing we accomplished, look how we move forward in this, to be that megaphone to take it back to my clinic, or to bring like the APTA magazine to my clinic to be like, hey, look what got done. You know, the same people like hearing, oh, well, what does APTA do for me? They did this. This is what the membership did. This is what the engagement did. Like, this is the value. So continuing to be that megaphone for the organization to directly be saying like, and being able to give examples. Because some people say like, oh, the communication is not that great. I was like, well, the communication goes out. Do you open it? Do you read it? You know, da 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 da. There could be, you know, a lot of different things, but still being just actively in the role of continuing to spread the word ourselves, to get out the word of what the APTA is doing, to show like, hey, people are really working hard behind the scenes. You may not realize that you're seeing the benefit of the work that's going on behind the scenes, but it's happening. And this is how you are benefiting from it out there, even though you're not in these spaces right now. So come be a part of that. So that's all I got.
I appreciate those words, Danny. That's great to see you again, and hope things are well in Kansas. Kansas is very lucky to have you. Yeah, no, I think those are very valuable. I really like the I was taking notes as you were talking, just so I can write this down and then connect back with our leadership team. And one of the things I took away from things that you mentioned was, it sounds like, and you can correct me if I'm wrong, but it sounds like one of the ideas you kind of talked about as a student is maybe something along the lines of mentorship. So as a student, maybe that student doesn't kind of know where to go when they're graduating from the PTA program, and maybe have somebody as a mentor that's on the inside, show them, hey, this is what APTA Ortho or whatever section of the academy you may be part of has to offer. So that way they can kind of get plugged in. And to Derek's point earlier, just, you know, this is a place where everybody knows their name and we can find belonging. I think President Covington mentioned, I think in a statement earlier that I had read, was something about inclusivity, and APTA is a community of inclusivity. I'm kind of paraphrasing here, of course, but I think I read something to that extent. And I think that kind of resonates with us all, is that we want to be part of something, right? We want to be part of a group, and hopefully APTA Orthopedics is that place where everybody does know your name, and you can get plugged in, you get connected and finding value. So hopefully through conversations like the one that we're having this evening, really the purpose of this town hall is really just, like I said, is really just to kind of hear from you all and what it is that you want. What is it that you feel is that would be valuable to APTA. So that's what kind of what I'm thinking when I hear that. So I think that's great. I see a question from Josh. Josh, did you have a question there?
Yeah, so I really wanted to tag on to your mentorship, and it's been a little bit since I've really dug into the ortho side of the website again, just because I've been busy with studies lately. But you know, coming back from CSM, I was gung-ho, right? So I was like, eyes were open to all the different chapters. Really liked the fact of ortho, and potentially I have a unique background of what coming out of an oil and gas background, and what I could possibly do with that coming out of school. And so when I got into the website, the first thing I started to kind of dig in and see was that mentorship thing. And I noticed the PT tracks, like you can apply, and like I don't know all the specifics, but you can apply and you are assigned mentors or something like that. I'm not exactly sure how that all works. Is that familiar to anybody on here?
You're talking about are you talking about the APTA Advanced Proficiency Pathway? Is that what you're referring to?
That could very well be what it is. All I know is
Okay.
that it's like you put in an application, and then by the next CSM or whatever, you've been assigned a mentor. You meet with that mentor at CSM, and then you go from there, or something like that.
Okay,
I'd have to
that
go
I'm
back
not
in.
familiar with. I know I can speak personally because I did the APT ortho pathways proficiency. So that's sounds like a little bit different. So with the pathways proficiency, which is also another opportunity for PTAs, is you basically apply for the pathways proficiency. There's some items that you have to check off, including clinical hours, whatnot, and then you go ahead and choose your mentor. So I happen to choose my supervisor that I work with in my clinic, and then she and I sat together, and there's a check off. There's a whole check off of things that you do under that proficiency. In this case, orthopedics, there's different tracks that you can do. Orthopedics is one of them. I think neurology is another, and there's a few others out there as well. But I did the APTA pathways into orthopedic proficiency, and the benefit of that is you're kind of specialized. So unlike PT, where you can get like maybe CS, I mean, not CSCS, but OCS certification, PTAs, that the certification is advanced proficiency. It's just a way to show others in your profession that, hey, you took the extra time to learn a little bit more about, in this case, in my case, orthopedics. So I took the extra step, so that way maybe my patients will say, hey, he's APTA pathways proficiency in orthopedics, meaning he kind of specialized in orthopedics, so it makes you more valuable as a PTA. But I think what you're referring to may be something a little different that I'm not aware of.
Yeah, I'm happy to jump in, Albert, on this. It's actually a really timely comment and question, because just last week, myself and our communications team met with Chrissy Mansfield, and Chrissy is the individual who heads up our mentorship with APTA Orthopedic. It has not been something that has been taken advantage of as much as we were hoping for in the past few years. So the reason we met with Chrissy again is because she's really excited to build this program, and our team is really excited to fully promote this program. And so our whole group, as we met, we were coming up with some really great ideas to really get this, to help grow this. And Chrissy is full of energy with regards to this, so we couldn't ask for a better leader with that. But I know that she is talking about looking at different types of mentors and mentees and mentors. And certainly the PTA track would be a great group to also have involved with the mentorship program. So stay tuned, because we're just waiting for Chrissy to return some additional information with how she wants the program to look and to run. And then we're going to start promoting it. And PTAs and PTA students are going to certainly be a part of that promotion. So thank you for bringing this up.
That's awesome. That's exactly kind of what I was hoping to hear. Because it felt very that was something that I'm looking for coming out of school. It's a very small class size, and so looking for kind of that leadership to kind of help keep me going. Just to, I don't know, help keep me growing and stuff, because I know that I don't have the peer support necessarily to fall back on once I hit the field. And just to be able to have the knowledge base and to work with somebody that has the years of experience and such would be great. And I was really kind of bummed, I guess, for the lack of a better word, when I saw it for the PT side only at that point. And so I was kind of hoping that we could pitch something for the PTA as well.
I've just started an email to her, Josh, so this is great. I'll let her know.
Perfect.
We got some
Thanks.
excitement.
That's wonderful, Josh. Thank you for bringing that information up, and it's exciting to hear that there may be something coming soon. So look forward to that.
And I'm gonna piggyback a little bit, if you don't mind, Albert. You know, the physical therapy can seem like a big pond, but really it's pretty small, and it's a place where you'll be able to run across people if you stay in it long enough. And it's interesting. One of the reasons I was excited about coming to the meeting is, one, to meet all you good folks and make some new friends and things like that. But also one of the purposes was to come in and meet you, Josh, because I know you went to our student engagement committee or our meeting event at CSM, and you got to talk to James Spencer a little bit, and he's the vice president. And he said, you need to go meet Josh. And so I'm here to meet you too, Josh. And so you made an impression on people at the leadership level. And so we want to encourage you to keep moving forward and look for opportunities. And if opportunities aren't there, forge a path forward, right? And I'm your connection to help you do that, okay?
I appreciate that very much, Derek.
So you were talked about favorably.
Well, many thanks to Tara as well for reaching out, because like I said, I didn't know anything about the orthopedic side of this until I walked by the booth, and she invited me to that, and I just took the chance. Kind of feeling my way through what branch I want to go into. Ortho sports, that kind of has always been in my wheelhouse, and where I've wanted to go for a long time. And so I don't know, I was the only one down there from my school as well. So I attended CSM, a very large event, by myself as a volunteer student, and just took a chance to go meet a bunch of people I didn't know, and met some really good people. So
Yeah,
thanks
and
again for
that's
the
really
kind
what you
words.
want. Yeah, and that's really what you want your engagement committee to do here. That's what we're here for, is you guys want a whole bunch of people taking a chance, right? And then coming together and creating a community of people who took a chance and become friends, right? So thanks, Joel.
Josh, are you I have not formally met you, and please reach out to me anytime. I love to connect with you. And are you a newly graduate? Are you a new graduate, or are you just a student?
Yeah, so I'm little background on me. I've got a bachelor's in kines, pre-physical therapy from early 2000s, master's in healthcare administration in 2009, and then got married and went into the oil and gas field and was there for the last 20 years. Just stuck. So, but due to circumstances with that, just felt like it was time to get out and re-pursue passions with PT, and found Rasmussen University up here in Minnesota, which is a 18-month intensive program. And I am starting my first clinical with them. So I'm in the last 8 months of my program now. So I'll do my first clinical here starting in May, and then I'll have 2 more classes, and then 1 more clinical, and I'll graduate in December. So
That's awesome.
yeah,
Congratulations. Yeah, that's
thank
great. I love coming to these town halls, and to your point, going to CSM, and not knowing people and taking that chance and getting to know people. I think that's what events like CSM or any conference like that can do, is bringing us together. Your story kind of resonates with mine a little bit about me. I was in HR for a little bit, so I was a HR manager for a number of years, and just kind of didn't really feel the heart for that. And my dad had Parkinson's when I was in high school, and really between that and just kind of finding my why and finding out what my purpose in life was, I went back. I took a chance and said to my wife one day that, hey, I'm going to go ahead and quit my job, and took a chance and originally started out in athletic training. So I have an athletic training background, and then went into PTA just because with athletic training, the ATCs were not getting paid under Medicare laws. So I had an opportunity to pursue PTA just because it was a better fit for me at the time. And again, like you, it was a 2-year program. I graduated from the University of Indianapolis back in 2015, 2016, and then just been practicing in outpatient orthopedics since then. And then during that time in school, I was very heavily involved with APTA in my state, in the state that I lived in, which was Kentucky. So yeah, I love hearing those stories because that kind of resonates with me. So I I definitely have a lot of respect when I hear stories like yourself, because I recognize the amount of work, especially with family and kids. I had a daughter who was, I think, 2 at the time when I started school. and I really didn't see much of that aspect of her life because I was in school for a good 5 years switching between ATC and PTA. So I definitely have a lot of respect for that. And it's really wonderful to hear stories like yourself, Josh. And I really appreciate you being on the call this evening. So thank you.
Yeah, thanks for sharing your story.
Yeah.
I was just if you don't mind, I did get a chance. I didn't meet a whole lot of PTAs in my time at CSM, but Minnesota did happen to have their own chapter get together, I guess you could say. And so I met a lot of PTs, PT students, and then right at the end, a girl walked by and happened to see my name tag, and I had just that day gotten a little PTA sticker, I guess. I'm a PTA sticker that you can put on your badge.
Oh, yeah.
And she grabbed me and she says, "Come with me." And before I knew it, I was sitting at a table with 10 other PTA students, and ended up getting adopted for the night basically, and wound up at the APTA educators award ceremony where their PTA professor was being awarded like teacher or professor of the year or something like that. So they're there. It's just sometimes everybody hides in the nooks and the crannies because you were a little outnumbered, maybe. I don't know. But it's good to kind of band together and meet everybody for sure.
Yeah, absolutely. And that's what, that's what it's about. Like Derek said, we're just trying to have a community of like mine, and maybe not so much, different different thoughts will bring us together and just kind of grow in our profession and doing what we love to do. I think that's really, really great. I think a lot of times people may not know opportunities that exist within our section academy. So for instance, I do research at the hospital I work with. So I've had an opportunity to present research at CSM, and I think there's some PTAs that don't realize they can do that. And ortho, if you want to do that, that might be an opportunity that we can talk about within ortho. So there's a lot of different opportunities within our section that we can do for PTAs, and it's just finding finding what it is that you all want as PTAs to be engaging. So really the goal, one of the things I was hoping to accomplish, and it looks like we're off to a great start this evening, is finding out what it is that you as PTAs would like, need from the ortho section to want to engage and be engaging and want to be excited about being an ortho member, and then inviting your friends so that way we can grow our community and make it stronger. So I think a lot of things that we've talked about this evening has been really helpful and great. So hopefully that conversation will continue to occur, and we continue to get some more ideas, exciting ideas to grow this community. And that's what it's really about. So thank you. But anybody else on the call this evening have any other ideas or thoughts on what they would like, what they would like to see or to be engaging?
Maybe even specifically from our engagement community Facebook page, are there content ideas that I think Josh on the call tonight is the only PTA that's actually on our Facebook page, if I'm not mistaken. But for content, what would you like to see? What would attract you to want to be a part of a Facebook page to engage in conversations and sharing?
I think it would be interesting to have potentially just maybe not stories aren't the right word that I'm looking for, but insight from PTAs that are out in the field that look different than just the clinic, right? So how are PTAs working in the field in ortho that is maybe outside the realm of a hospital clinic or a normal outpatient rehab. And how, because my thought is potentially there's areas where we could reach potential groups of students that would be very, very interested in becoming a part of ortho that never knew that they could work in industry X because they never knew that they could take it outside of a hospital clinic or an outpatient clinic. So like for me, one thing that got talked about a little bit at the the student interest group at CSM was, okay, I've got the background of oil and gas. Could I potentially think about how to take that back with OC Health, right? And do OC Health with the drill hands and such out in the field versus, so basically it's home health, right? Home health PT, but out at the rig sites versus relying on those drill hands to be coming into the clinics and such like that, where knowing them, they probably aren't going to come in for treatment, but most times. So just, I think what would be engaging is those stories or those insights from PTAs or even PTs that are working in fields outside the realm sometimes of the normal clinic setting.
So
I guess in general, what you're speaking of is just having people engaging their own personal experiences, even maybe outside of that scenario you're describing, on the Facebook page as a place to read and maybe comment on specifics on work scenarios, team scenarios. I guess I'm trying to figure out, when you joined the Facebook page and you looked at what content we provided there so far, a couple of updates, some links to some blogs, that kind of thing. And we'd like to really provide more content, but our audience is maybe, just a little bit bigger than our audience here today. So I'd just like any input from any of the PTAs here or PTA students as to what you'd like to see in addition to that, to make it attractive to you to want to join that Facebook page. I know there's a lot of PT and PTA Facebook pages out there, and a lot of them have a pretty big following, a lot of engagement about how the day went today, and what's y'all's productivity demands, is it too much, everything from clinical pearls of how do you treat this diagnosis when you've run into this kind of a problem. We seem to be at a plateau with this patient. Any ideas? We can have all that type of stuff on there. I guess what I need to know is, from a consumer standpoint, what would stand out for an ortho oriented Facebook page compared to any of the other ones out there?
So Jason, I think it's a great question, and I think there's really two parts of the question. One, what is the content, but also who you're trying to reach. And if you're trying to reach students, more like a Josh or Josh's contemporaries, then you can't deliver it on Facebook, because Facebook is not the delivery platform that they look at. And so I think you can make a step forward by saying, let's deliver it on platforms that the students actually utilize. And so if that's the case, then you can start to talk to our communications team at APTA Ortho and see, what are my options to distribute the information to in a manner that the students will actually receive, because they won't receive it on Facebook.
Fair enough.
One other thing I wanted to mention that I was briefly talking to Albert about before starting the meeting, we are slowly launching some mini communities. We have a community platform now, and we've had some issues with it, but it's working well with a few of our smaller groups. The health promotion and wellness engagement community is alive and rolling on their community, and we'll have the PTA one rolling as soon as possible. I have it basically ready to go, but just want to do a little testing, probably with you, Albert. But that's going to be a nice an open forum area that we're hoping is going to become a well-used area for our members. So the PTAs are going, we have a separate community we've got set up for the PTA community as well as a student community. So sitting here listening to the conversation, it's making my mind spin a little bit with how I'm probably going to need to get their tech people to help me set up a community that has both the PTs and the PTA students collected into it. So there's so many different directions we can go with these communities. So it is a lot for me to absorb with putting these together. But stay tuned, because I think this is going to be a pretty neat area for you all to take advantage of.
I'm looking forward to Jason and Albert doing their first TikTok dance together.
That sounds great, Derek. Josh, this question is not necessarily directed at you, but maybe just for the group as we're having these conversations, which I think is great. One of the things that got me thinking is, or got in my mind, is this PTA team. I'm blessed to come into an orthopedic clinic every day and work with some wonderful PTs in the hospital I work at. And one of the things as a student is maybe not knowing how to work in that PTA team environment. So I'm going to open up this question to anybody that's on the call this evening, but would it be helpful to have a video where we talk about just like a interview type format about what it is, maybe having the PT on the video and the PTA, and then just have an open dialogue and question about what does that PTA team look like, or what's a perfect PTA team as a option, and maybe just some other vignettes or video. Any thoughts on that from anybody? I'd love to hear your thoughts on that.
Yes. I got to at the Minnesota chapter, I sat down with I think it was some PT students from St. Catherine's up here.
Yeah.
And their professor as well was with them. And I put him on the spot on accident, I think, because I asked him, I was like, what do you guys learn about the PTA in school? And they said, oh, we maybe had like 2 hours where we discussed the working with the PTA. There was actually somebody that came in and gave us quick discussion over who a PTA was, what they did, and how they would interact with them. And that's all they got. And I saw this professor kind of just buck up a little bit and kind of shy away. And I was just kind of like, we got to work on that, because there's so much that we can do as a team, right? And I think the stronger that PT-PTA relationship is, the patient only has the benefit. And I think that is something that's, even in my own school for PTA, we harp on the relationship side of it, but all that's really getting taught to us is just what's required from the state board in terms of how often we got to meet with them, or how often we got to have notes signed and stuff like that. It's really not about the working relationship and how to interact and such like that. And to the point, like my first clinical, my CI is going to be a PTA. It's not even going to be the PT. And so, barring that my second clinical is with the PT, I may or may not have a working relationship coming out of school with, that opportunity. So I think Albert, what you're saying about having the vignettes or the little interviews and such, find a great team, a great PTA team that work really well together, and let's interview them and then put that out there, and you know, I don't know. I think a lot of good comes from that.
Yeah, that sounds great. I mean, I was blessed to go to a school where we had a DPT program. So they met during the day. So our school we were required to work with the PT students. So we had a student outreach clinic that we could volunteer at. So I drove up to Indiana. I lived in Kentucky at the time. So I drove down to Indiana on a Saturday morning and worked interdisciplinary with PTs. And then we had community patients that came into the student outreach clinic, treating real conditions, mind you, because these were folks that did not have the money to pay for healthcare. So they were, we basically did pro bono work. And then so the PT and myself, we worked interdisciplinary to help the patient. And so we were, I wouldn't say forced, but we were forced to work together. I know many programs, because of the dynamics of the schooling, don't have that luxury. I was blessed to have that. So yeah, that's great. That's great to hear that you would be open to having that information. That's wonderful to hear. I think there's a lot of value that we can add on the community page, whether it's interviews, Josh, like you're a student. So I think one of the things that may be beneficial as a student is, how do you prepare for the boards? Maybe we have some information about how do you prepare for the board exam. Maybe that's valuable to you as a PTA student, and could be valuable to a PTA who's newly seasoned or new in the profession, or maybe seasoned, because maybe that's a review for them that can serve as a review for some topics that they may not have that they've had to experience based on their current level of practice. So yeah, thank you. I want to be respectful of everybody's time. It is 8:30 this evening, and appreciate everybody coming on the call this evening and joining. And hopefully this town hall is one of many town halls that we have. I think the communication that we had or the conversations that we had this evening was very valuable. I hope you all found it to be the same, and I encourage future conversations to occur, and hopefully more engagements amongst all of you APTA orthopedic PTA members and students, and hopefully future members.
Thank you for doing all this.
Thanks everyone for spending their time here tonight.
Thank you.
Yeah, thanks. I appreciate it.